It's summertime now, and so most of us will be outside enjoying the sunshine when it's warm and sunny. Sunshine makes us feel good, and we love a good sun-kissed skin. It is also a well-known fact that we have to protect ourselves against the sunlight by wearing sunscreens at all times. But do we actually know why, and do we follow the advice? There are tons of sunscreens out there on the market, so do we actually know what we should be using? In this video, we're going to find out more about sunlight, the different types of sunscreens, and also debunk a few myths about them. Let us look at the spectrum of electromagnetic radiation for a start. This includes ultraviolet light with shorter wavelengths, visible light, and infrared. UVC rays form part of the ultraviolet spectrum, and they have the shortest wavelength. They are mostly absorbed in the ozone layer, and as such they don't penetrate through the atmosphere and cause skin cancer. On the other hand, UVB rays can penetrate through the atmosphere, causing damage to the superficial layers of the skin. They can cause the skin to become red, giving rise to sunburn and DNA damage, and this can ultimately lead to skin cancers. So the way I remember this is by remembering that B stands for burning. For UVA, this is subdivided into two types. We've got the UVA1 and UVA2. UVA rays have longer wavelengths, and so they can penetrate through the atmosphere and in fact even through the window glass. Similar to UVB, they are known to cause skin damage, resulting in skin cancers. Unlike UVB, they penetrate even deeper into the skin, causing damage to the collagen, and this can result in skin aging, leading to wrinkles and fine lines. So whenever I think of UVA, I think of A equals aging. So in fact, when people use sunbeds, UVA actually forms 95% of the UV rays. So in a way, people don't get sunburned easily, but over time, the UVA rays can cause skin aging and wrinkles to form. The other light that has received a lot of press recently is the visible light. Now, visible light is the light we see around us, and they can actually penetrate deeper into the skin than UVA or UVB. Visible light can cause indirect DNA damage through the production of reactive oxygen species. Now, in darker skin types like myself, it can lead to melasma and hyperpigmentation, whereas it causes redness or erythema in light-skinned individuals. Interestingly, studies have shown that high doses of blue light compared to red light is known to cause more hyperpigmentation. Now, let us move on to the topic of sunscreens and find out what the numbers actually mean. The first thing we need to know is SPF, also known as sun protection factor. Sun protection factor, or SPF in short, means the relative time a sunscreen can protect you from UVB rays. For example, if your skin normally burns after 10 minutes of direct sunlight, wearing an SPF of 30 means that you are 30 times more likely to last longer in the sun without getting sunburned. And so in this case, it will be 30 times 10 minutes, which will be equivalent to around 300 minutes of sunlight time before you get sunburned. And have a look at the percentages of UVB filtered by different SPFs after 10 minutes out in the sun. The next score we should be looking out for is the UVA rating, and this is shown either by a star or PA rating. The star rating goes from 0 to 5 and it represents the percentage of UVA radiation absorbed by the sunscreen compared to UVB. And the PA rating is also similar to the number of stars, where the higher the pluses in PA rating, the more UVA protection the sunscreen offers. So what are the different types of sunscreens out there on the market? Well, let's break it down. There are two main types of sunscreens available. We've got the mineral or physical sunscreens versus the chemical or organic sunscreens. It can be quite confusing when choosing the right sunscreen from you, just because there is a huge ton of misinformation out there, and also not all the information is available on the packaging. So let's break it down. The first one is the mineral, also called physical or inorganic sunscreens. They contain ingredients which are either zinc oxide or titanium dioxide, and the word inorganic basically means that the ingredients are not carbon-based. Mineral sunscreens mainly absorb light from the skin, as well as form a protective sort of physical barrier on the skin surface that reflects a small amount of light away from the skin. So in actual fact, even though they are called physical sunscreens, this is actually a misnomer, as majority of the function would be to absorb rather than reflect light. In fact, titanium dioxide can absorb UV rays up to 400 nanometers, and zinc oxide absorbs up to 370 nanometers. In terms of the advantages of mineral sunscreens, they help to provide a broad coverage against UVA and UVB. They are also less irritating to the skin because they are chemically inert. Zinc oxide also has additional anti-inflammatory properties, and this is very good at calming the inflammation down in acne-prone skin. Moving on to some of the disadvantages of mineral sunscreens. One of the big drawbacks of mineral sunscreens is that they often leave a white cast, and this is actually quite obvious on people of darker skin types like myself. Mineral sunscreens also have a thicker consistency, and so they can be quite greasy and uncomfortable to apply. They also don't offer as much UVA1 protection as some of the chemical sunscreens. So for example, titanium dioxide doesn't really protect against UVA1. There are microsize or ultrafine grades of mineral sunscreens, which are actually zinc oxide or titanium dioxide broken down into nano particles. And these help to minimize or reduce the white cast appearance, and it's actually quite useful for people of darker skin types. Because of their small particle size, they don't offer as much protection against the longer wavelengths like blue light or visible light. And this is actually quite important when we are counseling patients who want to protect against hyperpigmentation. Interestingly, we now have tinted sunscreens which have iron oxide mixed into mineral sunscreens. And in fact, it has become quite popular over the years because it allows the sunscreen to blend in with different color skin tones. What tinted sunscreens do is that they help minimize the white cast appearance by giving a reddish hue. They also help protect against UVA and visible light, and this is actually very useful for people who suffer from post-inflammatory hyperpigmentation or melasma. The other type of sunscreen is the organic or chemical sunscreen. And as the name suggests, organic actually means carbon-based. And chemical sunscreens can contain many ingredients like oxybenzone, avobenzone, and many more. Similar to mineral sunscreens, chemical sunscreens absorb light and turn them into heat in the skin. In terms of advantages, chemical sunscreens offer both UVA and UVB broad-spectrum protection. They also tend to be lighter in consistency and can blend into the skin quite well without leaving behind a white cast. And because their consistency is quite light, they can actually be used in combination with other skincare products. One of the disadvantages with chemical sunscreens, especially the older brands, is that they contain ingredients that can be irritating to the skin, and especially if you have got sensitive or allergy-prone skin, it might cause irritation and a rash. And with certain chemical sunscreens, such as those containing avobenzone, which is not photostable, this means that it can get broken down very quickly on the skin with direct sunlight, and so you will need to reapply the sunscreen quite frequently. The best sunscreen, in my opinion, is a sunscreen that you would use on a daily basis. There is no point buying expensive sunscreen and not using it at all. In my opinion, getting a hybrid sunscreen containing both mineral and chemical sunscreen ingredients will be quite useful because you get the best of both worlds. Try to find sunscreens with antioxidant properties like zinc oxide, niacinamide, and that would give you a boost when fighting against oxygen radical species. A good sunscreen should be easy to apply, giving a good cosmetic outcome, and also should do what it intends to do, which is to offer a broad spectrum protection against UVB and UVA. Now let's talk about some of the myths that have been circulating around sunscreens for years. Number one, it is not safe to apply sunscreens in young children. Guidelines have recommended that it is completely safe for us to apply sunscreens on children over the age of 6 months. The American Academy of Dermatology Association recommends minimizing the use of sunscreen in children under 6 months just because they may have more sensitive skin and they are not able to sweat and regulate body temperature as quickly as adults do. In young babies, they also have a higher body surface area to body weight ratio compared to older children and adults, which is why they may develop unwanted reactions to chemicals found in sunscreens. The best approach is to actually keep children away from direct harsh sunlight as much as possible by keeping them in the shade, especially for children younger than 6 months old. If you can't find shade, keep them covered using a wide-brimmed hat, long-sleeved clothing, and even an umbrella. Make sure they get plenty of fluids because children are often at risk of overheating and dehydration. For babies over 6 months of age, we often recommend using a mineral sunscreen rather than a chemical sunscreen because they contain less irritating ingredients to cause any reaction. Certain chemical sunscreens have also been shown to enter the bloodstream, according to a small study published by JAMA, which is a reputable journal. However, we still don't have concrete evidence to show that these sunscreens can actually cause harm to our body. Myth number 2, sunscreens are not safe for the environment. Some studies have shown that certain chemical filters have been found in water sources and aquatic animals. In fact, some studies have shown that oxybenzone has been detected in high amounts in the water sources, causing coral reef bleaching, and this led to a ban of certain chemical sunscreens in Hawaii. Luckily for us, the levels of sunscreens found in the environment is significantly lower than the toxicity level needed to cause harm and bleaching for coral reefs. We still don't have evidence linking sunscreen use with impact on marine life. More studies will need to be conducted for us to find out more. What we do know is that excessive sunlight has been linked with skin cancer, and so we need to protect ourselves as much as possible by using sunscreen at all times. And if you're concerned about the potential impact of sunscreens on the environment, you can consider opting for mineral sunscreens rather than chemical sunscreens. Myth number 3, using sunscreen may reduce the production of vitamin D in the skin, but this is only around 5% of all the vitamin D production in the body. Healthy adults should obtain an adequate amount of vitamin D by having a diet rich in foods with vitamin D. For people of lighter skin types, you only need around 10 to 15 minutes of sunlight to produce adequate amounts of vitamin D. There is of course a theoretical risk that people who sun protect themselves all year round may be at a risk of vitamin D deficiency. People of darker skin types are also at risk of vitamin D deficiency, which is why in the UK, guidelines recommend that high-risk adults should take daily vitamin D supplements all year round. For the rest, which is the majority of the people in the UK, the guidelines recommend taking a vitamin D daily supplement during the autumn and winter months just to replenish your vitamin D levels. And when in doubt, it is always good to get your vitamin D levels checked because then we know exactly what the levels are. Thank you so much for watching this video. If you'd like to know more about dermatology and different conditions like rosacea, you can check out my other videos here. See you next time. Bye bye.